It is potentially, not just in Gaza, but around the world, a series of decisions that could have profound consequences on the well-being of so many people. I think Gaza is a good example, Eleni, because all this foreign aid from the U.S., billions and billions of dollars, have been frozen, but with a handful of exceptions. Military aid, so weapons and other security aid for Egypt and Israel, are exempt, as is critical food assistance. So obviously that is good news. So much of the aid going into Gaza is food assistance, but anything that falls outside of that when it comes to people in Gaza or Palestinians in the West Bank, for example, whether it's security, infrastructure, health, vaccination, so much of what you and your previous guests were just discussing, that is currently frozen, and that could have significant, severe consequences. The executive order that the White House just put out a couple days ago said that so much of the foreign aid infrastructure and bureaucracy is not aligned with American interests. We also heard from the new spokesperson for the State Department, Tammy Bruce, saying just a few days ago that the United States is no longer going to blindly dole out money with no return for the American people. So another country that did not get an exception, Ukraine, of course, they're getting all kinds of military aid, but also billions in humanitarian aid that is critical, help for their infrastructure, for electricity, for schools, on and on. PEPFAR is a name that is known to so many in our audience. It's a highly successful program that was started under George W. Bush to help people around the world with HIV/AIDS, saving some 25 million lives. Assistance for the PEPFAR program has also been put on hold. And so there are real concerns. We heard that concern coming from the United Nations, the UN Secretary General asking for more exemptions to this sort of blanket executive order. But certainly what we're going to see in the coming days is almost certainly a realignment, a restructuring of U.S. aid around the world. Eleni?
All right, I want to bring in Dr. Jean Kaseya, the Director General at the Africa Centers for Disease Control and Prevention. Dr. Kaseya, thank you so much for taking the time. And it's a critical moment. I know how PEPFAR sort of changed the fight against HIV/AIDS from where I come from in South Africa. It affects many African countries. You've got the suspension of U.S. aid for 90 days. And in his executive order, President Trump claimed that U.S. foreign aid and bureaucracy isn't aligned with American interests and American values. Tell me why it is important for America to fund these kind of programs, specifically PEPFAR and generally anything to do with the medical industry.
Thank you so much for having me, Eleni. Let me start by saying that in Africa, we are grateful for the support that we are getting from the US government, mostly in the health area that I'm leading in the continent. Just if we need to give an idea, in 2024, we got $8 billion of support from the US to African continent, and 73% went to the health sector. It means today the US is the main partner that we have bilaterally and also multilaterally through a number of organs and organizations. What we see as a trend today in Africa, it's not just the pause from the US government, but it's also the reduction from assistance from other Western countries. And that one is a major threat to not only Africa, but to the world. And as Africa CDC is projecting with this trend to have around 2 to 4 million additional deaths annually. And that one will also increase the likelihood occurrence of pandemics. This is why we think that we need to continue.
So Dr. Kaseya, Dr. Kaseya, I want to talk about the mpox breakouts. I want to talk about the Marburg virus, and if there isn't funding to try and ensure that these breakouts don't spread, what that means for the rest of the world and for America in particular.
When I declared mpox public health emergency of continental security in Africa in August 2024, we had only 6 countries. Today, we have 21 countries affected. And out of $1 billion pledged by partners, including $520 million from the US, we only got 47% of this money. Without funding, this mpox that is affecting almost around 45% of African countries will continue to spread. Don't forget that mpox in 2021 affected US, Europe, and other continents. There is a huge risk if we don't get this funding pledged by Western countries that mpox can even become a next pandemic.
That is an absolutely terrifying prospect. So you're saying even the freezing of these funds for 90 days could have massive global ramifications, and it needs to continue. So what are you going to do to try and fill that vacuum that you're facing right now?
While I'm calling the US to consider additional exemptions to the 90-day pause on its foreign assistance to ensure continued delivery of critical emergency response activities, I'm also hoping that the pause will be lifted promptly. I want to say that I'm prepared to travel to the US to engage with the new administration in discussions about enhancing collaboration in the health sector between Africa and the US on our shared and mutual interests, because this one is what is putting us together as human beings in the same planet.
So I want to turn our attention to what we're seeing in the eastern DRC. And the M23 rebels in Goma right now. There are many people that are displaced. Actually, over many years, it's said that over 7 million people have been displaced. You're very concerned about the health situation right now. Hospitals are overwhelmed. What conversations are you having with policymakers to try and ensure that things don't get out of control there? What's your biggest fear right now?
I know Goma. Goma is a city of 3 million people, including 1 million displaced individuals living in an area of 75 square kilometers. That means a population density of around 39,620 people per square kilometer. If we need to consider Goma as a country, it will be one of the highest population density in the world. But what we saw also in Goma, and it's important for CNN, people are following CNN to know that end of 2023, a new variant of mpox called Clade 1B was identified in this region. And this variant is mostly, the factors of this variant are mostly internal displacement due to armed conflict, overcrowded displacement camps, and increased human mobility due to insecurity. Today, what is happening in Goma can lead for a chaotic situation that can even result to a major pandemic, because we see this fragility of health system in Goma. We see this humanitarian situation going on, and I call upon all of our African leaders and our international partners to stop what is going on in Goma, because Goma is a fragile area that can kill all of us if we have a pandemic coming from this area.
Wow. Dr. Kaseya, to end off, you're asking the United States for an exemption. You're saying you're willing to travel there to make your case. It sounds like a scary prospect in terms of the risks that we face. Do you believe that you can find a way out of this? You've said in local media in South Africa, there's a win-win situation we can look at. Tell me about that.
I think all of us, we have a common interest. We have a mutual interest. While Americans, they have to focus to build America, we in Africa, we are also building Africa. But what is putting us together is how can we not talk again about assistance, but talk about programs that can support development. Today in Africa, we need programs that can create more jobs for our young people, that can help our young people not to migrate again to the US. We need programs that can put our countries together, that can generate economic growth. I think this is the kind of program, and the health sector today in Africa is moving from liability to an area that is creating jobs with the local manufacturing, like of our medicines, vaccines, and other diagnostics. We are talking about a market in 2030 that will be around $260 billion. This is a big market. And we need now the US to start to work with us to invest in Africa.